Hello, my name is Sarah Dietz and I'm a registered dietitian. Today I will be discussing controlling type 2 diabetes with motivational interviewing by registered dietitian nutritionists to lessen the burden of a chronic disease. To provide some background, it is important to examine the larger problem. According to the CDC, the number of people diagnosed with diabetes in 1958 was less than 1% of the population. Today, 30 million or greater than 9% of the US population has been diagnosed with diabetes. The health implications of uncontrolled diabetes are well known and impact several systems throughout the body. The potential for diabetes to affect all systems should be a strong enough motivator for change. However, individuals with diabetes may find it difficult to change, and ambivalence is common. As the incident rate of type 2 diabetes increases, it is necessary to investigate different interventions. This study proposes the use of a registered dietitian to employ MI techniques to interrupt ambivalence. MI is a person-centered approach that should also be directive. In an article written by Zoffman and others, there is said to be a spirit of MI. This spirit should be made of partnership, acceptance, compassion, and evocation. To continue to build upon the spirit of MI, as explained by Zoffman, it is important to consider the four guiding principles of MI. This intervention style should be based on individuals' needs and should be developing throughout counseling sessions. The four guiding principles are as follows: expressing empathy, developing discrepancy between future goals and current state, avoiding arguments while rolling with resistance, increasing self-efficacy and optimism for change. In consideration of the impact of type 2 diabetes and the true patient-centered focus of MI, the following proposed research is based upon this question. What is the efficacy of intensive nutrition therapy as directed by a registered dietitian nutritionist while employing MI techniques in an adult population with type 2 diabetes? According to a practice application written by Hollis and others for the Academy of Nutrition and Dietetics, the efficacy and cost-effectiveness of MI in dietetics practice has not yet been established. It is the intention of this proposed research to contribute to the conversation of training RDNs to provide MI in their daily practice. To begin to look into the literature review, we will start with Jones and others, a meta-analysis. They found a positive reduction in HbA1c levels. However, it was not statistically significant. The authors suggested that there was reason to continue exploring MI, especially as a method of helping diabetics successfully control their condition. Song and others, a meta-analysis, found that RNs who utilized MI techniques were most effective at lowering HbA1c during a 6-month trial as opposed to a 12-month trial. Christie and others, a clinical review, found several studies that provided evidence for and against MI as a helpful strategy. However, overall, it was noted that there were twice as many studies with positive results as opposed to negative. Ekong and others, a systematic review, found only 3 studies out of 13 who noted a significant reduction in HbA1c levels. However, positive changes were noted in food choices, weight loss, and BMI. Overall, MI was considered a good way to motivate diabetic patients to change their dietary habits. However, more study was required. Lee and others, an original study, did not find a significant difference between the control and MI intervention group. However, there was a statistical difference between groups in regards to their insulin resistance scores, meaning if insulin is becoming more sensitive, your fasting glucose numbers will trend closer to normal. To analyze the effects of a control group versus an intervention group, a minimum number of participants must be established. Completion of a G-power analysis, a priori independent means t-test, was ran for this proposed study with a medium effect size and a calculated probability of less than 0.05. This provided a result of a minimum of 176 participants needed to obtain significant results. Most studies have an approximate 20% attrition rate. To calculate for attrition, an additional 36 participants should be recruited. To promote the proposed research, investigators would start with the hospital's IRB. Upon approval, investigators would visit all associated facilities. This includes the hospital, satellite clinics, quick care, outpatient rehab therapy, and an endocrinology office. The participants recruited would be a convenience population. Investigators would visit each site to discuss the proposed research with office managers, physicians, and faculty nurses. Copies of the informed consent will be available for staff and potential participants to review prior to consenting. After participants have signed their letter of consent, all efforts will be made to ensure confidentiality. Investigators will review the applications of individuals interested in the proposed research. They will be allowed to participate if they qualify for all of the inclusion criteria and none of the exclusion criteria listed. After enrollment and informed consents are signed, participants will have an HbA1c drawn and their BMI calculated. These measurements will also be drawn at conclusion of the study. Comparisons will be made of the means between the control group and the intervention group at conclusion. Each group means will also be analyzed within their specific group. This will be accomplished using G-power through independent t-test or the paired t-test. This study will be proposed to last for 6 months with 4 dietitian counseling sessions lasting 45 minutes each. The control group will receive a standard informing style of nutrition education, while the intervention group will receive counseling with motivational interviewing techniques. The counseling sessions will be held once a month for the first 4 months, and in the subsequent 2 months will have phone call follow-ups. To ensure the dietitian's ability to practice MI, it is suggested they undergo training. Zoffman and others discussed the training of healthcare practitioners in MI and reported it should consist of a 2-day workshop that incorporates subsequent supervision. Once completed, fidelity assessment should occur. This can be completed by using either the MI Treatment Integrity Tool or the MI Skill Code Tool. The fidelity check is necessary since MI is a patient-centered approach. During the course of this proposed research, there were some factors that can be considered limitations. The nature of MI causes it to be a potential limitation. The patient-centered approach is very difficult to standardize. Participant recruitment is a limitation as it is not truly random. The length of the study could also be considered a limitation. 6 months is a short amount of time in comparison to the lifetime of a diabetic. A final limiting factor is that an exhaustive study of the literature was outside the scope of this proposed research. Throughout the literature review, it was found that the majority of health professionals using MI were not dietitians. More success was also found within the 6-month time frame as opposed to longer term. This investigator wishes to see if dietitians can also be successful in that time frame. The effort to reduce chronic disease is dependent upon justifying different methods of interventions. The proposed research would help contribute to this conversation by providing more insight to a major problem while improving quality of life. Thank you for your time, and I hope you enjoyed this presentation. The last 2 slides are simply all references.